How would you tell a friend that they had bad breath?
I have no nice way to put it. No. I just say check me.
No, you just have to. No.
Welcome to the Edson Breedy Experience.
Welcome to the Edson Breedy Experience. I'm here with. Oh, I'm already lucky. Yeah, I'm here with the lovely Kemba Kamada and Dr. Nalini Perfect Hair Rampasad.
So I can't see it.
So even though her family makes fun of her for not being a real doctor because she's a dentist, she's making awesome content on TikTok and Instagram for her new business, which is holistic_healing dentistry. Dentistry, right? So you can find her content on TikTok and on Instagram. So make sure to like and subscribe because you'll see all sorts of really important information that will help you improve your dental care. All right. So in prep for this episode, well, first of all, welcome. Thanks so much for
having me. Really.
So I know Nalini in a few different ways. She's my Taekwondo student, and she also is involved in like therapy and mental health stuff, so we usually talk about that. And she actually helped me overcome my fear of the dentist because I think that it's one of the things that I'm most afraid of. Really, I feel like my mouth is really sensitive. I don't want anybody there at all. But she's able to help calm me down. So thank you so much for helping me overcome that. Right. So.
But the irony is that that's the whole basis of the that she does.
Yeah.
Told me into that, which I'm sure we're gonna get into. And it's really cool because again, there's always a synergy with these guests that I personally going on the outside, also connecting to healing and putting yourself out there and trying new things. So
what's the name of that?
Healing Queens.
Healing Queens.
Yes.
Which is an event with like where you dance in
dance class in heels, and heels classes are really
Healing.
pun intended.
Eminem came up with that.
Right, but it is very one quality. It is very embracing the femininity, embracing the sensuality.
Anybody who's ever breakthrough in session?
I don't think so because they're actual proper heels. You have to ask me.
Yeah.
I have to ask you.
I feel like you're quicker fall down and break your heels.
Yes. So you really learn to lean into yourself a lot. So in your whole journey, I feel like that's a crucial part of what you get to do.
Yeah, I actually tell people that I specialize in people that are scared because like everybody is scared. 90-something% of people are scared, and the other percentage of them like very paranoid about something going on. So they're always like, look at this. But
That's what happens. That's 100%.
yeah.
So I warned Noemi a bunch of times before I went there. I was like, Noemi, listen, I know you've seen me fighting people. I've been a coach. I've been doing push-ups. But it's going to be a different person in that chair. And so on a scale of 1 to 10, right?
Because you're allowed to tell me too.
Yeah.
Like that's supposed to.
Yes. It went pretty smoothly, but I just wanted to make sure the image of me wasn't completely broken when she saw me on the chair. So I gave her a lot of heads up. On a scale of 1 to 10 of fear, right? Then the fear, right? Where was that?
I honestly don't think we're that bad. There are people who like they hyperventilate and actively breathing exercises with them. I thought you were going to be worse.
Oh, I came in doing breathing. I was like,
Good. You had that before, right?
So in prep for today's episode, I'm doing something new. I downloaded this app called NGL, or Not Gonna Lie, to try to get some anonymous answers to questions about dentistry and people's experience with like oral health stuff, and I end up getting a lot more than I bargained for. It was wild.
I'm sure
It was wild. No, I posted, so I made sure to post everything. I didn't keep it. Yeah, so posted everything.
Not this one.
Posted everything. But so one of the questions that I asked, so these are anonymous answers, was how would you tell somebody you care about that they had bad breath? If you had a friend, how would you tell a friend that they had bad breath? There are very few people that I have told that they had bad breath and that we were not close. I didn't want to create a issue or whatever. But I think if they're like with my very close circle of friends, like my top 5 friends, I'll just pull them aside and say, "Hey."
Wow, you're real true. You're real true. I don't think I've even as a dentist
You would tell-
ever.
No, because I'd be like, I'll divulge. So like, so hey, if it's somebody I really care about, and I don't want them to get embarrassed by other people,
Right.
I would pull them aside and be like, "Hey, I need to get mint or you need to get some gum. Your breath, that's it.
You have no nice way to put it, huh? No. I just say check me.
No, you just have to no. Hey,
But also you're right.
yeah. So I mean, so you say you wouldn't do it for your friend? You wouldn't tell
No,
them?
I wouldn't do it. I feel like I was put it happened a couple of times with people that I was not that close with.
Yeah.
And I feel like time and place it was not right, and I was just like,
Would you be thankful though if someone told you?
yeah,
Yeah, you need to know.
yeah, it's true. Yeah, like I saw people when I have stuff stuck in their teeth, but the bad
But you
breath.
also can't help it because you see stricken people's teeth. Like,
Yeah, all the time. But like, no, that's also an awkward thing to do. Is to be like, yeah, but I always tell them that. But the bad breath, I think, is a hard.
yeah, especially when you say ages.
What if you have body odor? Would you tell them?
Yes.
Oh yeah.
You tell the close friends. How far? How
Yeah,
acquaintance? Your coworker. Yeah, how you tell?
it depends. So, what is the impact on you? So, coworker, right? Just an example, but like in a friend who usually all like, and my name is Hillary. So if somebody
Yeah.
comes to me, and somebody is always come and find me, it's fun.
Oh.
You're so nice.
Yeah.
And like, me, you shut up. And so they will say, and come on, this person is. I'm like, what?
Wow, I'm so glad I was never put in that situation. Yeah.
I've been put in that situation a few times.
Why would they put the both of us? Just to think that anyway. And so it is none of those kinds of conversations is that ever easy.
Yeah.
I think once you pull them to the side, that's cut a lot of it. Obviously don't do it like
We don't
in front of.
I would, if anybody else talks to me, I would never want them to know.
Of course, yeah.
Everybody.
Oh, what not? Actually, if it was a really close friend, yeah, I would tell them. That'll be easier. But
If
like,
it's
you
a
see, when
group
it's
of
like just somebody you don't know that well, I feel like I don't know how to go about that without making them more conscious.
If I really knew that, I mean, I'm just thinking about a good space where it's like people.
Mm-hmm.
If someone on the team, I'm just having pretty young. This person have like mold in it, or this person, I kid you not, we had a co-worker many years ago, who used to sit and he had like GI issues, and so he just used to kind of have that escape unconsciously. He didn't try to escape.
Oh, God.
It was tough. He actually ended up getting really sick.
Oh no.
And yeah, people were like, yeah, I don't know how we're going to talk to him about this. It was like,
I guess it was really bad.
it was
Disease guy.
yeah, he was really unwell. This conversation kind of like, hey, you know, just put it, it's very private conversation. Is everything, the first step is everything okay? Are you alright?
Mm-hmm.
Why? Because that's kind of like, maybe something is wrong. Like, you know, we realize, and again, it's we, so it's not a it's
Yeah.
we realize
That's
that
worse.
depending on, you know, when you sit in the office, there seems to be a bit of an over. And we're not sure if it's just the space where you sit instead of routine your patients,
Yeah.
or if, and then
This is a week. This was a group. This was an intervention.
never.
Okay, because I one one.
Okay.
Always a one-on-one. And again, it depends on who it is.
Yeah.
So if I don't necessarily like the person, care for the person, or respect the person, and they come into something I will do. It's not the same. And so I try to make sure that if I'm the person, I'm going to do what is the rapport that I have with the person, especially if it's not
Mhm.
That's hard. It's not impossible.
So have some nice ones here. Have some nice ones here. So actually everyone was kind. I thought I would get some spicy ones, but these are pretty decent. So the first one was your mint or gummo. Because really,
Maybe
truly,
just have them, it's like you just pop one and you're like,
yeah. So because I feel like, yeah. So like I feel like this is a good one because I feel like if someone sit down to have a serious talk,
yeah,
like what you describe as like,
you'll be like awkward.
Yeah. But again, that is the environment was one that
You had to, yeah.
that's really
Okay. I know. I just like for me, I think I'd still be like it would hurt me more. Me personally, more,
Yeah.
if someone had to have a formal talk about my body odor versus if there's like something going on there, you know,
Yeah.
check this out. Or it would definitely also hurt more if it's the opposite sex. I think I prefer if a guy told me
Yeah.
than especially if it's a good looking.
Shame.
All this time I thinking, you know, I watch it. Yeah, I watch it and I seen the girl watching my camera across the room right now. I was like, yeah, I get all this contact, I get this about the GT and she's like, hey man, let me pull you aside to talk. I'm like, all right, yeah, you want me to come over there? All right, there too. And then she sits me down to give me the order. Yeah,
You're
so-
right.
The next one is ask them if they have a friend and that they really care about and don't want to hurt their feelings. How would you tell them they have bad breath? And then personally, I'd maybe tell them I have bad breath and the list reasons I think it could be, and then say it's mutual or something. So.
You know what?
Wow.
That's not fair.
That's a
They're really good
response.
It happened to me too. It happened to me too. And when it was happening to me, this is why I do.
Stones.
So maybe you could try this.
Yeah.
I like that one a lot. Even if that's not the truth.
Man, that's crazy.
Even if that's not, once upon a time, listen, been there, done. All this time now is because Dr. Google,
Yeah.
I called Dr. Nabini, you know, like, listen, something is happening.
Yeah.
Oh, that I actually use this strategy with these students.
Mm-hmm.
For the teenage taekwondo class. To a skill level. But I use that
You should
strategy
have seen your face.
because
It is when they come in after they did it. It's feel like he's feeling. He's opened the windows.
no, but they probably don't know. So I'll tell them. So I mean, thank God for Kyle Farrick.
Pick up
Kyle Farrick. He was sent on a mission to help me out. Unfortunately, I went to it was like grade fete. It was grade fete, like upper 6th grade fete. And I think I went to some party and I went up to some girl to dance. And it was Kyle's friend. Apparently, it was terrible. And then she told Kyle, and then Kyle was like, he had the intervention. Obviously, he thought it was hilarious to tell me. And then he explained to me, he sat down and explained to me, and I never had this talk before. He explained to me the difference between antiperspirant and deodorant. And no one had ever had that conversation. I'm not sure if you all ever had a parental conversation about it. But I used to have something called, there's this old spray called the Right Guard.
I know.
Yeah, and my God.
Was not the right thing.
It doesn't work. So it's no longer on the shelves. It's no longer on the shelves. Yeah.
Probably wasn't even really
So my dad used to use it, and he used to smell good. However, that was not working for the eye. That wasn't working. So then, she explained that to me, and then I ended up switching, and then I found like they have like clinical deodorants, like like supermarket just have like I think Dove has one. I think Gillette also has a clinical deodorant. Those would real with Dove. So I was pointing the kids in the direction of the Dove 24-hour because that is real with Dove. I guess. So the next one is if it's a lover, tell them that it would be nice that both of you should go do a cleaning. If it's a friend, say first time I smell in your mouth what you eat.
What's happening? Like a really good friend.
Where you had your mouth.
what?
We had them out. So those are the three that I got. Those are the three that I got. And I was like, I told all two were
I have a story. Yeah, but yeah.
Tell her.
It's ready.
Tell her.
No, for later.
Yeah, it's a little bit greater.
Yeah.
Okay.
Wait, okay, so those are my three stories about, so I think you gave your story about what you'd say. You had given a story, you said you'd give them, for the mint.
I think, yeah, like thinking, I'll pop on and be like, but what if they say no?
Right. No, so this is very important. So there's this meme, like, they have like, so there's a meme that I came across, like 100 rules of being a gentleman or something like that. One of them is, if someone offers you a mint, do not think that they're just being nice and courteous and asking you, like, you just want, how does that happen to share? Take the mint.
Yeah.
Don't just automatically take the mint because you don't
You
know.
never know. Yeah.
Because often you can't smell your own breath, but somebody else can smell your breath. Yeah.
I am surprised a lot of the times that people can't smell their own.
You get accustomed to it.
Yeah, there are people with blindness, but like,
It takes 3 minutes for you to get accustomed to smelling this one.
yeah. Well,
I think so. I mean, that's
I really desensitized. I really don't care, like, when anything. People just be like, why just eat lunch? I don't really care. But nothing to gross me out like that. Very few things to gross me out anymore. But sometimes I just wonder. Because, like, we had a trick in dental school where we would be like, put Vicks on the inside of the mask and all kind of things. But I just wondered, like, you must smell it.
No, they can't. They can't smell it.
Or like, you're going to open up a cavity, it's like,
Well, yeah.
and there, or maybe there, I don't know, but
Or maybe they've gotten used to it.
yeah.
Yes,
Or maybe
take 3 minutes.
or maybe they wonder. Maybe something is going on, but they don't know what again.
What it is,
I
yeah.
don't know what is not normal.
Right,
So this is normal for me. Because
right,
I
because that's how it
have
is, yeah,
for 10 years.
Yeah.
In my mouth, right? And I never got sorted.
yeah.
So that's normal. It's 10 years of whatever
Yeah.
that is. Or accident first.
Yeah.
I don't know.
It takes 3 minutes for you to get accustomed
Yeah,
to
yeah.
smell it.
I was
Right.
crazy.
So what I was gonna say, if a guy is a 10,
But
but with breath smell,
He's not a 10.
no. So aesthetically, he's a 10.
He's
what
not
does it
a
bring?
10.
Right. So what does it bring him back? What does
I
it
think
bring
it
him?
depends on how bad.
yeah,
It depends on how bad.
It's bad enough for, you can see how far away, for you to smell it.
that far.
Nah.
From okay, for the viewers, from how far near the window.
Nah.
So that's
He's
like,
not a 10. He's not
yeah.
a
So,
10.
What
so
I
he's
drop-
aesthetically.
he's a
yeah, what are you
6.
dropping them to?
That's a 4.
He's
Well,
a 6.
I would say though, like if you're in like a party situation, I've realized that when people mix certain drinks, they
Yes.
kind of smell a little weird.
Yes.
Like
So
alcohol.
I allow them.
Right,
No,
okay,
like yeah,
that's-
alcohol mixed with certain things. Like even I think if you mix it with like gum or mint or food, that little combination sometimes will be a little deadly as the night progresses.
Well,
Yeah.
I guess your nose would be very attuned to
Yeah.
what
Yeah.
is different.
So, I mean, environment will matter. Like, in a casual setting, there's no party
Yeah.
by, 10 days
Right.
kind of thing.
Yeah, yeah.
That's a fight.
Yeah.
Feel.
Yeah,
It's definitely it's a feel.
Open it up a lot.
Four less might drop to a 3 for me if we go at a time.
Right.
That's happened. That's happened. I remember there was this girl in medical school. She was gorgeous.
And I want to know
And we went to some event at this place that was off the avenue, Roscoe's.
Roscoe's,
Yeah.
Yeah, and Roscoe's doesn't exist anymore, right?
No, just study it. I went hospital.
But it's cool.
So we
I went and then we never like interacted like in a
outside school. So.
outside school setting, and then I was getting that vibe. I realized we're not getting a little ting. So then I came in to talk to her, and she was real smiling and talking up to me, and I was like, and I just felt the attraction just plummet, and I was like,
Yeah.
so now what I do is if ever I smell, and I can tell that she's so happy. There's no way she knew that I was good. I tell you. So now what I
3
do
minutes
is,
past, basically.
yeah. So what I do now is anytime I smell somebody else's breath, I'd be like, I just click the switch and be like, my breath, what you smell? But like, let me find a minute, just in case. I doing the same. I doing the same thing.
So that brings up an interesting thing that I saw passing by. Maybe you have to try to give yourself right. Have you seen that Vice President has been, of course, released, right? And he's making a lot of interviews. There is a clip that floated around social media sometime last week or so, where he's doing what looks like a podcast. He's sitting down next to someone who's probably at that distance with Victoria. And the man is just like constantly just. And then, of course, the analysis went in, and they like, do you realize that it's only one vice president speaking from the
Oh Lord, no.
this man is just kidding me.
Really?
Yeah. That is like pop culture infused into this, but you know that he's part of what is this TV?
So the
Graves?
Graves disease, yeah. So that's probably just tossing his system inside out. And he was in jail. So you know what kind of dance it is.
Yeah, he probably have a lot of things to get done.
Yeah.
But I will find the clip. And the man is like, at first it looks like maybe he just like kind of
Like his nose.
right, and then he's
But he must be. At least it sounds like he's aware. I mean, if you were in the
Bandana.
bandana, he probably wearing the bandana.
I saw a comment that said, how is he wearing a bandana? And somebody sent help for the bandana, which is always yellow. Because the bandana is not doing
Oh God.
That's not easy. That's
Yeah, he fights now. He make it. I'm sure he'll sort himself out. He have the resources.
That's a fact. Probably driving a bike on the next one.
I'm sure there are people.
I was gonna say,
I'm sure there
you'd be
are people who have been 3 minutes, you know.
3 minutes.
3 minutes ago, they have. So I went on Reddit and also came up with some interesting stories that dentists and other healthcare
I'll say before.
Yeah. You break down. You're like, done it.
Ah, yeah.
Experienced it.
Yeah.
Yeah.
Okay,
So
that's
let me
it.
know if any of these have
Sounds familiar. He said,
the worst thing we've ever had in practice, and the practice I worked in, was this guy that came in for a couple extractions. Mid-extraction, the molar that was being pulled out slipped from the clamps and fell straight down his throat and got stuck. It took 5 minutes of him coughing until he finally swallowed it.
oh my God. That's what happened. What? That must have made its way out. What?
What if that was a what was caused?
I'm like scared. Yeah.
What would cause it? That's just like,
It was
you know,
Honestly, it can happen. No, it can really happen. The mouth, saliva, everything is very slippery, but they always talk about protecting the airway so you can put some gauze at the back there, but you don't always do those things because people are uncomfortable and, you know,
you could go like,
you can just put some gauze just kind of late. That's it. Yeah. Just,
Like
you're not gonna tough it out. You're just gonna lay
Yes,
a piece to
sometimes have some
block the
friction, a
airway.
little friction.
Yeah, a little barrier so you don't digest it.
so that was one. And then two, what did you do? In that water.
After I panic, I hide the panic on the
Exercises.
After they swallow.
after I swallow. Well, it's not going because it's worse if he's like choking on it.
Yeah.
Oh my
You'd
God!
be like, swallow.
Here's some water.
Swallow.
Now that this has happened, maybe I might hand him a glass of water and be like,
But then you have to worry.
right?
But then you have to worry about it coming out the next one.
I mean, it's
It's a whole
something- it's a very good breakfast.
Some fruit juice.
Wait, okay, yeah, what's the next one? I thought I could relate, but no. Next.
I love doing root canals, but the smell of opening up a dead tooth is horrendous.
I've been
As
saying.
soon as the oxygen hits the long-standing dead nerve, it's worse than an old lady fart. I
Yeah.
get whiffs of dead tooth the rest of the day and get paranoid that I reek of dead tooth until I can get home and shower. I don't know, I have no idea what a root canal
It
is.
smells. Yeah, it smells really bad. Like that's what I'm saying. Like when you open up a cavity, sometimes then old lady farts. Yes.
So
You choose your right words.
Yeah.
if my mood means simply well, a root canal is when the usually caused by a cavity that's been treated. And so it rots the entire tooth, correct?
Not the entire tooth, it just extends to the nerve.
Right.
So once the nerve, bacteria enters the nerve, it travels down the tooth, and then you only have two options, which is either extract the tooth, the bacteria drains through the socket, or you do the root canal, which is essentially cleaning out the inside of the roots
The entire.
and like putting some medication in and then pull it. But it could happen. Other reasons you could do a root canal, but when it is due to decay, yeah, it's be kind of
And
like a
that's-
huge.
That's when we smell it.
Most times, yeah, or like it smell could also come from like when you have a lot of calculus build up,
Correct.
and
Fragmented.
yeah, and yeah, just a big cavity somewhere.
Okay, next one. Not a dentist, but my case has been a nightmare for my dentist. I have a tooth impacted way the fuck up in my nose, rather close to my eye. It's taken a team of 4 separate dental professionals and 8 years to even begin to sort it all out.
I was leaving that unless that was causing a problem. I'm no trouble. I'm not touching that.
So
Yeah.
in fact, I actually had
6 minutes.
an impact.
I also have impacted wisdom teeth.
I think a lot of people have impacted wisdom teeth,
and
and so no one can take that out.
I have impactful wisdom.
and it was causing like I had slight property.
Right.
So the discussion of hey, I think we need to remove this, and I was like, yeah, what that?
Mm-hmm.
I'm not gonna make it. If you'll have to do
Mm-hmm.
any kind of extraction on my mouth, I'm sorry.
She's you.
No,
I want to hear the end of the story.
Right.
And so I asked my dentist, like, what would you? And she's like, I'll do that. This is make flat. She does not do wisdom teeth extraction.
Right. Yeah. Not everybody do that.
Because I'm like, look, it took us a long time to get to this comfort level.
Mhm.
I'm no longer like with background noise in my headphones when I come to you.
Yeah.
What do you mean you're not doing this thing? She's like, it's too risky.
Yeah.
I just won't. Some dentists will not take you that way. And they'll refer you to the
The,
dentist.
yeah. The oral surgeon.
And there are many dentists who now.
I love it. I'm not gonna say like I really like it now.
Yeah.
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 It depends on the case.
Yes.
It depends on the case. But I actually, when I do it, I feel at home. It's very weird.
Perfect.
But I like it.
holistic underscore
Healing
underscore dentistry. And I guess
Underscore
it's
limited.
because we're so invested in making people have a creative sleep
Yeah.
that
Very
we're
patient
spending
focus.
The good news is that I went and I did some x-rays,
Mhm.
and in as much as they were pockets and impacted, they were out. They were
Mhm.
fully,
Crown.
yes, folks and lines.
So you keep it clean.
You try my best.
Okay.
I
He
get,
was like, I'm not taking it.
I get my,
I don't want to take mine out either.
I've not been as on the ball with it, but I get my dose daily
Mm-hmm.
as well, and then I make sure that I see my period because of one side that was more impacted than the other.
Is the upper? The uppers is a breeze to come out. The lowers is a bit,
pressure.
yeah, is a bit tricky because the bone is like thicker. There is more impacted, and you have to like you make an incision for that. Sometimes for the uppers, well, a lot of them I find is pop out really easy. But some of them could be complicated. So maybe yours was a bit complicated where it's like close to your sinus, so you have like a curve in the root or
I
something.
have sinuses, you don't do that. And that's what another. So I went to another
Same.
dentist who normally does. She would have done it, and she was saying that she asked me, "Hey, you know,
Mm-hmm.
how sensitive?" And like the ones in Sahara does.
See, I'm the Sahara's detective.
Exactly.
Same.
Yeah.
And it was very, she was like, I don't recommend that you do it simply because the root might be fine,
Mm-hmm.
but it might just, it's trauma to the overall area.
Mm-hmm.
So to people have to do it,
Mm-hmm.
we will do it.
Okay.
And I was like, okay. And then I went to the.
Yours is the lower.
Oh no.
So the thing is with the lower as well is when it's impacted into the tooth in front, so it's trapping food there
Yeah.
and causing decay of the other teeth. I've seen people lose 4 teeth instead of taking out the wisdom teeth because it's causing decay
Right.
on the one in front. And it's like kind of at a deep level, so Once you keep it clean, we'll check on it. So we'll keep checking on it. And
Yes, I got a water flosser
Good job.
and started doing this coconut
Pulling.
oil. Oil. That is so effective, so it might no longer bleed at all when I floss.
So you, right, good. So I want to make sure and say that coconut oil pulling is an adjunct to flossing. Yeah, don't just like do that alone. You have to like. So I do it in the morning and then I floss in the night. I think that's been. And you actually feel the difference.
I do coconut oil pulling while I shower, floss, then brush my teeth, and then
Oh, twice, once for the day. That's it.
it's pretty good.
Yes.
Well,
Realistic.
okay, that's alright. That's alright.
So the reviews are joking about people. I mean, I know it's been everywhere. It's a trend in natural medicine. What is it?
It's basically swishing coconut oil in your mouth and like trying to. It's kind of weird at first because the consistency of oil in your mouth is kind of weird. You have to get accustomed to it, but you just kind of getting it around. I don't know. It's hard to say. I don't know the science behind it because
I was thinking about that same thing, and I don't know why it works, but it
I
breaks
think
up
it's
the
because
tablets.
it's
Soft,
kind of
soft.
thick. And I don't know, coconut oil seems to be
Things-
the healing of it. Like,
Yeah, things things tend to dissolve into the oil, so the oil can extract it.
Yes.
Yeah.
What dissolves?
So
Anything.
the bacteria, things tend to dissolve.
Yeah, it's kind of, it's because of the thick
The oil traps it.
it's kind of push it out a little bit. But I feel like there's like some beneficial healing properties. I used to look
So
at it. I should have did that before.
No, I mean, I don't know that most people would even know what, because when I hear the term coconut oil,
Yeah,
Well,
it doesn't sound like something.
I think it pulled.
it
Pulls the stuff
it
out.
pulls.
Yeah, and that makes sense. So you literally just get like a teaspoon of coconut oil.
Yeah, and you put it in your mouth. And like,
And
I
then
think
Swish it, swish it
Yeah,
around.
but for longer.
longer, like
2 to 10
5.
minutes.
5.
2 to 10 minutes.
Yeah. You can start for like 5 minutes and then I do the same thing you do. Like I do while I'm doing stuff. So like while I'm making up my bed, while I go to bed, and like the longer you have it, then it's kind of better. But as you can see with like the bleeding, it really does help with that. But it just feels, you don't think it
Yeah,
feels,
definitely. It
feels
works, for sure.
different. It
For sure.
feels like shrinking.
Shrink.
Yeah.
Because that's the feel, that kind of clean feel that you get
Yeah.
with from using like this.
Really? Not fun, I like it too.
I like it in addition to everything else.
Yeah.
So like that is the icing on
Okay.
the cake for me because then everything's shrinking.
Yeah.
Why do I do it?
I think it's just me. I think they have good electric toothbrushes now, right? But I think that's really for when you have some manual dexterity issues is why it was
Right.
created. And I feel like it makes people get a little bit lazy. I feel like you're not consciously brushing your teeth. So you don't have like I don't think I would feel comfortable doing it.
So for me, what I like about it
Mhm.
is that, and this is paying attention to, put it in and you feel
Mhm.
Agitation.
agitation, especially on the gum.
Right.
So that is I'm actually much more tuned in.
Mm-hmm. Okay.
Ooh, this is an interesting sensation.
Right.
I kind of like it.
Right.
So I'm going to do.
I
Okay.
thought you were been worried about too much agitation.
Yeah, so like
At the same time.
but that's why I say I have good ones now that's preset that is not going like they made it so it's not gonna damage your gums, I guess. Yeah. But in my mind I feel like there are a lot of people that do things mindlessly. They're just like and they're not paying attention to where like so the back of the last molar, how do I get in the back there? I try to get everywhere. Yeah.
Besides toothbrush, if you have like a small jaw and like
Yeah.
lift the gum, the
And-
cheek.
Yeah.
And also practice space in the jaw. You had to drop that bottom jaw to make sure
Yeah, you just
get
close a little bit
space.
and you get in the back.
Do you do a fish every time like that? Every time you brush your teeth?
I don't have to anymore.
I definitely
when
drop
it
the
was,
jaw.
When it was first really impacted me really bad, it's
Mhm.
like done it, and I was like, I really
Need
have
to do
pay
something.
attention because the dentist will always like
Mhm.
to be able to.
Yeah, some of them impacted to your cheek, so
Yeah.
you can't really reach it properly. So yeah, you're right. You have to do that for some.
I just get on in the back there.
Yeah,
sure, for sure.
But the calm
Every
down
single
does
time.
make a difference. The
There
calm
is
down
some
makes a difference.
spots that people miss a lot, which is the inner surface of the lower
The
teeth.
lower,
They tend to have a lot of build-up because the mind is doing it beyond conscious portion. When you
Not
conscious,
really
you're like,
paying attention.
you have to cover all the surfaces.
last story.
Yeah.
So my partner used to be a dental therapist and worked in schools. He remembered this one little girl who opened her mouth and each tooth was surrounded and full of knotty pieces of her black hair. Just everywhere, masses of it with gum too. He can't forget the horror from seeing and cleaning it all out. I just imagine it to be like cleaning the shower pool. You ever saw people?
That was it. So there's like a story. There's like dental jokes memes when they're doing a cleaning for a patient and you see a curly hair stuck in the bag there.
What were you doing?
They have a good night.
But like I don't know what's this situation
it's like-
about
Probably a kid who's like,
by the hair. Oh yeah, people yeah, do that. Yeah. But yeah, that was my story. I did find it.
do you address it?
And one thing I always know at my little party trick is like party trick in the dental office is you went to the movies last week. When you eat popcorn, the kernels can get stuck in there for
days,
long.
yeah, weeks sometimes.
When they say no, I didn't go to the movies last week. I was like,
I was in the movie since 2000.
yeah.
I made a ridiculous amount of popcorn last night. I just was here.
That's good there.
My mom has popcorn Tuesday. I did not pay attention to what I did. He's like, this sounded nice. Sure. I like threw him into it. Needless to say, no one else was able to eat the popcorn with me. And then the brand of popcorn was a different one than my mom gets. So every popped kernel had the husk piece.
Yeah.
Piece.
Oh.
I felt as soon as I ate a couple of meat
Yeah.
and I felt them. And you feel the irritation.
Yeah, but sometimes you don't. It's get lodged very deep down, and you don't feel it at all. Especially if you don't flush that there for that could
No,
find
it-
a home.
It was like 3 days. For 3 days I was brushing and
And
flossing.
you're feeling it.
And no, different ones.
Oh,
Man.
they found temporary.
Different ones. So I brushed and I'm like, okay, what is going on? Am I still feeling There's another one.
It's not like little pieces that irritate your gums, and then it's like
And then my
get
gum was
irritated.
bruised
Yes, get bruised.
because of it.
Yeah.
And but we
What's the worst now? What's the worst now? What's this?
Coffee. That's what like sticky things. They say definitely that's the worst one to eat because those kind of chewy toffees, chewy things.
Is
All of those, they tend to get stuck. So if you have like deep fissures in your teeth, they tend to go like the toothbrush bristles can't get in there. So
That's
that's why
sugar.
they say it's like sugar getting stuck there. Yeah, so that's definitely one of the worst things. Yeah.
no kind of coffee.
I have one particularly vile patient. She was lying back in the chair. She was lying back in the chair. She felt something in the back of her mouth, so she just spat it out forcefully, straight up and onto my face. I get rage every time she shows up to the office.
Yuck!
Yeah, but-
That's so rude.
Yeah.
So-
Yeah, but no one of those. I'm sure some movie enough to do it.
No, actually, I really do get really nice patients. I like real nice, easygoing people, but I have gotten the one or two Karens. But nobody really
It's
enough to do that. But stuff is flying in your face, but not that they're doing it. It's just like, I just get accustomed. Like, you clean out a cavity, and when I have on my face shield, I'm like seeing it all coming to me.
Really?
Blood, germs.
You didn't have a fish.
No, because they're not selling it anymore. The ones I like is the ones with the glasses, and I have to use just the goggles, and I feel so gross now.
You like
It's
see
Don't tell them anyone in your life. Oh.
no, like I just haven't seen since COVID. I'm not seeing the glasses ones.
Yeah.
That's the ones I like. The ones that have like the band around is kind of hit my head. But yeah,
So would you tell your patients, let's just say like someone who did that in television, this person is stuff, would you ask them not to come back?
I'll say I feel you should get a second opinion.
And then there's never people to book every course with book up work.
Yeah, you should check somebody about it. No, I hope that doesn't happen because I usually don't like to turn away people. And it have the rare difficult people, but what does this take about for me? Yeah,
Right, I got the attention.
Let's talk about it.
So
Yeah.
you never turned away.
No. Treat everybody that. Yeah, I treat everybody that comes with the.
Okay. One of the stories, I won't go into detail, but it was just saying that they're complaining about patients who don't spit out their saliva or swallow it.
No, patients who want to spit too much. Every minute, I want to spit.
Well,
Is there any
and this story.
specific
So this is
No.
the story. This is the story I was talking about. That's what I would
Right.
talk to you about.
Yeah.
Which is that. So he was saying how they like do the whole thing and they'll be like, and not the token. Because they're not talking and they just want you to either suction it or spit. And they thought it was annoying, but I definitely was doing that because I didn't want to. Because I know they had like fluoride stuff.
No, I rather that than I want to go up, I want to sit up, I want to spit, and I'm like, there's nothing there. There's nothing there. The suction is dry. I just need to come up, I need to spit.
mental?
Sure.
Something's there.
Sure, for every spit. For the 10 times. Sorry, no, I don't mind. But.
So no, suction. Because that, I know, my face was like that because
Yeah. My chest pipe.
10 years later, and you still
Yeah,
so
it's-
long. It just
It takes too long. It's like
She has a
something
fancy
that
shape.
takes.
It's really nice.
Thank you.
Really nice cook that.
Yeah.
She has a meditation room.
Oh, yeah, let's get into
A
that.
meditation room. People who I guess are nervous before they
The
come into this of that.
99% of
Calm
people.
down.
Yeah.
Yeah.
I love my meditation room. Even though I use it the most, I created the good vibes in it, but it is so useful. A few patients use it, some of my friends. And it's nice because, as I say, a lot of people are anxious, and you can connect your phone to the Bluetooth speaker that I have. You can change the light on the speaker, the light bulb is a Bluetooth speaker as well, and you can put a nice little calm lighting. And I was telling you, just 5 minutes of your time, just do a little guided meditation, and it'll naturally calm your nervous system, and you'll come in and kind of be in a different
It's not very cool.
of recording.
You should do,
Of me doing it?
you should do like an audio specifically for calming
Oh,
people down.
me
For,
doing the audio.
like saying it, for like calming people down for the
The
procedure that's
procedure.
going to come up.
Okay,
That would be kind of cool.
I feel like, yeah. Yeah, I might do that. Yeah.
But I think, but to that point, so my dad was telling me that his dentist, really sweet lady,
Mhm.
is doing something very similar.
Really?
Not in that exactly, but his whole thing was, he's like, why do you going to the dentist? Like, we're going to do
It's this. You remember the
I was like, you don't like the dentist? I said, no. When you walk in,
Mhm.
it's just different space. And
A lot of people told me that.
Yeah,
Yeah.
I feel like certain dentists are
Have that vibe. Yeah.
on the importance of creating
It's
yes, it's
safe.
already sterile, it's already
A safe.
smelling like a hospital, right? You don't see the silver pan with the thing in the
Yeah.
and you're hearing the sounds in your head and you have trauma from the last time.
Yeah. When you were 5 and they, yeah.
All I need is a little racist. I just need a little bamboo for some reason.
You really need to come. A lot of people, when they walk in, they really say, and I love when they voice their opinion about the office, because I'm like, yes, it's just these little things. They're like, when I feel really relaxed, or, they find really comfortable, or whatever. But in the room itself, too, I put little things too, like a little,
Diffuser.
yeah, a diffuser with like some scents, and I'm gonna put like a nice waterfall painting. I recently put up my paintings that I did in the office.
You
That-
can.
Yeah, I love it.
Side first thing.
Yeah?
Talented.
Nice.
Right now. One moment I was like,
Oh, I cannot give away my paintings. It's like hard to do.
sorry.
So you get people who appreciate the aesthetic, the vibe that you created. You ever notice if people trying to book extra appointment because
They like the vibe too much
No.
for me.
because they like you, and it's like I feel like I need to take out this Next month. Next month.
I've had people like that. And yeah, somebody say, like the dentist brushing your teeth. No, you go by the dentist so much.
You know what? You come every time I clean.
Yeah,
Yeah.
I feel like they feel comfortable.
You think that's something you should correct? Like if you're a professional, realize people are coming to work, no, you shouldn't, right? You should just let them enjoy the service more because you're still providing a high quality service.
Yeah.
It's just that they enjoy
If they
it.
cross a line, I'm not afraid to go.
All they're doing is just booking more. They're just booking.
True, you come
Clean it. I need to clean.
Well, you don't have to clean every 6 months, but like let's say they have stuff to do when they come in. If I get a weird vibe, like
Nowhere vibe.
vibe,
They just booking.
Oh, well,
So
What else I could do? Well, I could polish it. Whiten. I want to do a whiten.
This is very small percentage of people. I have people like that, but it's because they're paranoid.
Yeah.
What's this spot here? I'm like, natural staining on the teeth that the crevice. Yeah, it's a stain, it's fine, it doesn't feel like what happens. Yeah, I see it's something here. Yeah.
Then this fucking joy every day it's still there.
Yeah.
Very feel about this like after my blankets.
Ew.
I don't know, like I don't know. I don't feel like it's the best thing because I feel like those could be different functions. I haven't really looked into it too much because I'm just like say that blind man again. I'm like this not
Can we get away?
I just feel like I don't trust him on that note. Yeah, it could have good ones, I don't know. Like that may work, but then the sensitivity is too out. Like the whitening system I got, they have like a remineralizing agent that you put on your teeth after that kind of helps with because you get a bit of sensitivity.
Yeah,
I've been through.
a lot of the home kits.
But like years ago when I done one, it came with a remineralizer.
I feel like at home kids people can abuse that as well. And like, I don't know. I don't even know why that's a thing.
Because aesthetic.
Yeah.
The ones from the
Because my natural white is just really like an egg.
Yeah.
White. And there's no one thing. It's like somebody somewhere got this norm that said it has to be this.
Yeah.
TV. And then they show like UV things, and then you see the difference. You're like, oh, that's like this is pretty good.
But no, like sometimes it's too white, and it's like.
You do the names?
I love doing front build-ups, like if a tooth is broken or like you have a space. So yeah, essentially it's veneers, but this direct composite veneers.
What's that?
That's like me freehanding, building it freehand. Whereas a veneer is a traditional veneer that you would do would be in the lab. It would be made in the lab. So you do a little preparation and then you kind of a little preparation. Not like it doesn't have to be that small, but you have to create space to put something. You can put something basically. And yeah, you send that to the lab and have that made of porcelain or something like that. But with these composites, you could kind of touch that up if you need to. Or the veneers you can already.
Yeah, I'm gonna do a tweed course. I see a tweed course.
By a barber.
That's great. A lot of people doing these veneer tech courses and stuff like that.
Veneer tech.
Yeah,
I don't know what is a veneer tech. My friend said me that and I was like,
yeah.
Veneer tech for your teeth.
Speaking of that, I saw people doing it with like a nail polish thing.
People get wild out here.
That's part of the composite process.
Yeah, nails kind of similar because there's acrylic particles in it, but I feel like people are really wild out here. Like, how are you trusting any and anybody with your permanent teeth that you're never getting back? Like, how are you chancing that?
Yeah, and what I've been seeing with like the full-on porcelain veneers is that people would notice that all they want is this really scary chocolate looking perfection. And they're taking their perfectly fine healthy teeth. They go and buy these nails like people feel like working from the basement, working from the living room.
Yeah.
Right?
Yeah, they do at home visits.
These snuggle,
Mhm.
looking things. Popping
You can like Voldemort.
and then they're falling out. They're not lasting. And they're left with their snuggle.
So it's
Mm.
unhealthy at that time. Veneers, like, because I hear something about like veneer breath or feeling like food is like really like stuck to the veneers or something like that.
Okay, so you could get recurrent decay under any type of restoration. It depends, and some will last as long as you take care of it. So if you're not flossing and you get it professional cleanings done.
I'm gonna continue the past trend.
Mm-hmm.
You with a guy, he's bald and he wants to get hair implants. So he's
It
been
does when you're ready.
Yeah.
To be sure.
Yeah. Same thing.
he wants to get another color. He wants to get veneers.
I mean, me, I would advise him to keep his natural. You know why I realized, and I think I didn't persuade in a video or something, but somebody was saying everybody is starting to look the same.
Yep.
And like, I actually like sometimes a little twist, and it might look cute, it might make your smile look cute, and then you just go change it to look like flat, straight, white. Everybody's looking like.
She's saying.
I can understand when you want to make like you have a bit of crowding, you kind of want to straighten it out a bit, but I feel like the veneers, the whole veneer front business, I don't know,
You could make a grill.
a grill. Well, it's in
Yeah,
lab really,
yeah.
you make it. You just take the impression and give the lab the instructions. So I'm not actually making, yeah.
Who's the lab? Who's the
It depends on which lab you're working with.
who's the lab that make good? Like, if you could go to and get grill done. So,
Somebody wanted one, they say they don't come back. They say, yeah, I'll come back, I want to do a grill, but they don't really do it. So no, I have not made a grill for anybody.
interesting.
Okay, gotcha.
Yeah.
Just not sorry, it just dawned on me. When you say the implant, you're talking about the ones to like
Place missing teeth. The screw that goes in and the
tell us how the burger.
about roughly $20,000 for one. It could start. There are some places that may have it a little cheaper, like 16,000 and stuff like that, but generally is around that price.
And then there's the cost for the actual procedure.
No, I believe the 20,000 is the whole.
Okay.
Yeah. Yeah.
I could
I've heard it's expensive, but it is
This is excluded probably like exam and x-rays and stuff, but I think the 20,000 would be like, yeah, the whole procedure, because it's a little long, because like they'll have to implant the screw, wait for it to integrate, so take about 3 months, and then, yeah, so what is the best and most aesthetic option for replacing teeth? They can have the money.
could never do a creep. I could never imagine having
Maybe now,
five. So just the vibration.
If it's an implant, it doesn't-
yeah, it have nothing there. It have nothing there. Implants are still replace missing.
But then you have to do like a scrutiny to the
So
bone.
yes, yeah, so the screw is in bonus, but it's like, you're numb.
I just
Not You're numb. Why? You're numb for the surgery. You're not numb
No, it's
after.
important to
the bone is
yeah, the bone, the teeth drift, teeth super erupt,
Yeah, things move.
things
around.
move, yeah, because you're eating every day, so teeth are going to move over time, and then when it drifts, so like you have this space when the tooth is gone, when it starts drifting inwards, let's say you lose other teeth now, and you want to get a denture made or some prosthesis placed in, you don't have this space anymore, you have this, and now nothing is seating there. Apart from that, you have nothing there opposing. So this tooth actually goes down until it touches something. So if it's not if the teeth didn't tilt, sometimes it tilts, it touch here. But let's say there's nothing there, it touches the gums on the bottom jaw.
So then, random question. Instead of the implant, are you able to do a 1-2?
Yes, I do want to dentist, yeah.
Okay, and what cost is like
Me, I think that my price is like,
No, it's fine.
Yeah, but like-
Whether it's
The prices.
15 or
it's
20.
pretty good. I think it's pretty good.
Right.
So I would charge like 2,500 to do a 1-2 denture, 25 to 28 depending. Like maybe a 2 kind of thing.
Right.
But I would tell people, I think so there's three main options to replace missing teeth, which is the denture, a bridge, or the implant. sometimes if it's too expensive, I say get the denture to hold the space so that you can do something else later on.
And then start
Just instead of like not instead of doing nothing.
So, question: What is the weirdest thing you've seen inside a patient's home?
Other than the thing here.
Is that has the better? What is called that dot at the back of the shoulder?
The
The spot.
uvula. The spot?
Yeah.
The actual hanging.
No, not
What
the uvula. Like, yeah, isn't there like the bruise?
Oh, the bruise. Yeah. Okay, there's
What's
something
called the
like that.
bruise?
Yeah, the
What's
bruise.
called the bruise? The bruise has a name, right?
Does it have a name? And we just know it as
The bruise?
you had a nice night, huh?
Oh, that's what you
So, yeah.
But it's not it's big at the
Yeah,
top of your
palates.
mouth. Oh,
Palates, yeah.
I don't know.
The soft
I
parts.
have no idea where does get
What
bruised.
was the question? Weirdest thing?
Yes, Edson, you shouldn't know.
Yeah.
Yeah. The weirdest thing, sometimes I feel like a magician. Sometimes, like, I'm like taking out stuff from my account and I'm like, whoa, there's a lot of stuff in here. I'm like, you're hoarding food in here. You're saving this for dinner.
Oh
They
no.
laugh. I like the movie for that.
Yeah.
But it's like a lot of. When I say a lot, I know you're thinking it's handkerchief, or that's how it's be.
Like a magic trick.
No. Like use your finger to quantify. Use your finger to
I
quantify how
have
much
to
stuff.
take, no, I can't, because it's be all kind of thing. Chicken coming out, this, so you eat some salad. I'm like, what? I could guess your whole meal for the whole day and yesterday, because sometimes just have a big pocket there, or like the cavity is big and it's just like, that's it. But other than that, was a weird thing. I don't, yeah. So,
Wow.
yeah.
Okay.
Have you ever caught a patient in a lie about their dental habits?
Every day.
Which is good. Is this good? Wait, how is that?
If they tell the truth, they say no, and the person says, I commend you for your honesty. But the minute they say yes, I floss, and I can tell when somebody lying, I say, well, you're not going to know. You can lie to your girlfriend, you can lie to your boyfriend, but you can't lie to your dentist about flossing.
Right.
And just about visible calculus.
No, it's
Bleeding.
about bleeding, yeah. Because like if you floss before you come here, it's not going to make a difference. Your gums have been inflamed for probably 5-10 years, however long it didn't get cleaning done is inflamed or floss, and it's like, yeah, it's not going to make a difference. But I don't scold anybody. Just kind of say, well,
I'm always honest. I'm always. Have you ever said,
No.
no, man, what?
Well, it's happened like once every 2-3 weeks.
Yeah, and I've gotten so much better and diligent with it. I see any feel difference. I have no time to be like, well, yeah, something. I'm like, hey, what's this thing?
The last time I flossed was 2 months ago.
really, no.
I will tell my
You?
dentist. I will be honest with my dentist every single time. She gonna know.
Yeah, she'll know. But the thing is, like, I just encourage them to. I say I know it's hard to incorporate into your routine as an adult. It is hard to incorporate anything into your daily routine, that is. So I should say, jump on the floss and train. And then you will fall off at some point. Probably if you go out, you go on vacation, you kind of, slip up, but jump up and
Step up.
train.
That's the most important.
Because you'll stay down for a long and then just won't do it again. And that's with any habit too. So.
I mean, and that's the thing, like, whether it's clustering, whether it's
Go to class.
going to class, going to the gym, going to
I have a rule.
You're sounding like Nalini right now because Nalini has the craziest schedule I have ever. No, like for real, there's not even a.
What else are you doing?
No. She does beat me back.
Yeah.
I think.
It's
No. Wait.
Think about that. Think about that. Because
Mine is-
you're the person I know with the
It's like
craziest
your
schedule.
job kind of interviewing there.
Think about it.
No, Nalini is just. No.
Compare.
When she's telling me about this, make me feel sad. When that's how
it's
people is feeling when.
fulfilling.
When we hear about yours.
I thought my schedule.
Uh-huh.
But it's fulfilling. Is it? Yes.
Exactly.
I just been going in the. I wonder who's getting most with me or Nalini, boy.
I feel like really gets this.
Yeah, I think
She definitely looks like she gets most. It could be the concealer.
Not just that. I feel
You see? Now, if I take my little thing and set myself up,
Yeah,
A little syrup.
Cover it
A
from us.
little syrup.
Yeah.
But yeah, so I want to direct everybody to holistic healing dentistry on TikTok, Instagram, and where's your location? Where's your and Facebook? But where's your actual location?
It's at KBS Plaza in St. Helena.
Okay, KBS Plaza. Hey, I can remember the area, but I think that it would. I think anybody in the area should definitely check you out. Awesome personality. If you're afraid of getting dental work done, she's place to go. Tiny hands compared to my last dentist, who was like 300 pounds at the time, and had my back arched for the duration of my dental visit. But yeah, great work, Lily, and awesome conversation. When we have our next virtual talk, I'm definitely going to try to have you on once you could spare
Yeah,
6
this
hours,
time,
6
right?
hours to come and
Yeah.
chat with us.
But also,
Mhm.
do you have time?
Definitely want it back. Synapse Medical Services Limited for sponsoring the Edson Breedy experience and helping us achieve our dream of having authentic, interesting conversations with Caribbean people, professionals, young professionals about interesting, awesome topics.
It was good. We really went beyond space and time, went to different realms.
It's always ended up that way.
Yeah.
It always ends
My
up that way.
conversations always go that way for sure.
But it's fine because I feel like all four of us are like,
Yeah, I can
Yeah,
remember
it
really.
makes
It was
sense.
good. It was good.
oh, that's not making sense.
Yeah,
Say more.
Yeah,
That
I was
makes sense.
excited.
So thanks as well to you, Edson, for making sure that you bring these awesome people into the space. And for putting my camera today for the first time.
Perfect. Thank God for those affirmations. Synapse Medical Services Limited for sponsoring the Edson Breedy experience and helping us achieve our dream of having authentic, interesting conversations with Caribbean people, professionals, young professionals about interesting, awesome topics. So, guys, like and subscribe to the Edson Breedy experience on Instagram and YouTube and TikTok so you could see more of our content. We'll keep the shorts coming. And if you have time to listen to our audio, it will soon be available on a few different streaming platforms. Thank you.